This is the Temporalis Muscle. Now, don't be fooled because it's actually at the front of the face. So where our temples are really, to the side and to the front, but this is only a two-dimensional picture. So the origin is the temporal fossa, which is this hole here, and the zygomatic arch, which is this arch here. And it inserts on the coronoid process of the mandible. So it fills this kind of gap here, this one. And that is the temporalis. Its function is to elevate the mandible, to lift it up and press it against the skull. So its job is to lift this bone up. So for eating and things like that, the temporalis. Okay, so the head obliques. Now there are three of these. The capitis, the caudalis, and the cranialis. So caudal means towards the tail, cranialis means towards the head, capitis means head. So they originate on the spinous processes of C2. So C2 is the second one. And they insert on the dorsal aspect of the wing of Atlas. So dorsal means top. So the top of the wing of the Atlas. So you can't, I've drawn over the top of it, so it's hard to see. So they cover this one, and there are three of them in that small space there. Their function is to extend the joints of C1 and C2, so the Atlas and the axis, when they're contracting bilaterally. So when they're contracting one side at a time, they contribute to rotation and flexion of this pole. We call it the pole area of the horse, and also to help stabilize the neck. And that's our head oblique muscles. So here we have our longissimus capitis and atlantis. Et means and in Latin. So capitis, head, atlantis, atlas. So it originates here and the articular processes of C3 to C7. So we've got 1, 2, 3. So 3 is here, there. 4, 5, 6, 7 here. And the transverse processes of T1 and T2, they're the two under the scapula that you can't see. And they insert, the capitis portion inserts on the temporal bone, so up here, and the atlas portion on the wing of the atlas. So you can't quite see that, but it's here under my red line. And they travel, well, this way actually, that way. Now its function when contracting bilaterally, the capitis portion elevates the head, so lifts the head up, and the atlas portion flexes the neck. And when acting one side at a time, they bend the head and neck laterally. And that is longissimus, capitis, and atlantis. So now we have the rectus capitis. So it's actually, there's two, dorsalis and lateralis. My writing is terrible. So dorsalis originates on the axis and the atlas. So that's our first two cervical vertebrae. And lateralis originates on the ventral arch of the atlas. So that's the ventral arch of the first cervical vertebrae. And they insert on the occipital bone, which is this bone right at the center of the skull. So their function is the dorsalis portion elevates the head, so lifts the head up, and the lateralis portion flexes the head and bends it to the side. So these are really, really important pole muscles, especially for collective work. And that's rectus capitis, dorsalis, and lateralis. So now we have our rhomboids or rhomboideus. So the rhomboids sit under this crest of the neck. Now they originate on the nuchal ligament. So this is the funicular portion of the nuchal ligament, and C2 to T8. So they have strands down the lamellar portion of the nuchal ligament as well. So C2 is the second one, the axis to T8 all the way back here. Okay, So all this way here, that's where they originate. And they insert on the medial side of the scapular cartilage. So that's the bit underneath. So they insert here, but on the underneath. And they go like that. Boom, 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 boom. The rhomboids. So their function, when contracting bilaterally, so both sides together, causes elevation and abduction, so to take the forelimb away. So when only one side is contracting, so unilaterally, it elevates the forelimb, lifts the forelimb up, brings the scapula, so this shoulder blade here, forward, and upwards, and stabilizes the trunk. So it's a super important muscle, and that is the rhomboids or rhomboideus. Next we have the Serratus Ventralis cervicus or cervicis, depending on how it's been spelt, English or American. And it originates on the transverse processes of C3 to C7. So 1, 2, C3, 4, 5, 6, 7, the transverse processes. And it inserts on the upper third of the scapula, but actually on the medial side. So it goes like this. Now its function is to assist in bringing the scapula, so the shoulder blade, forward. It also raises the neck when the limb is fixed. So when the limb is flexed, sorry. So when the horse is moving this limb here, it helps to raise the neck. It also works with its thoracic portion, the Serratus Ventralis thoracis, to suspend and stabilize this upper portion of the trunk here. And that is the Serratus Ventralis cervicus. So now we have the Serratus Ventralis thoracis. So we just did the cervicus, which is here. This is the thoracis here, and they do meet underneath the scapula. So the Serratus Ventralis thoracis originates in the body of the 1st to the 9th ribs. So here, in the body of these ribs, and it inserts in the upper third of the scapula on the medial side, so underneath. And that's these muscles here, right where your saddle and your girth are. So their function is to bring the scapula backwards. So the cervicus brought it forwards, and the thoracis brings it backwards. When it works with the cervicus, as we said before, it helps to suspend and stabilize this trunk section of the horse here. And that is the Serratus Ventralis thoracis. Now we have the multifidus. So the multifidus is a very deep muscle, and it originates on the articular processes of C3 all the way down to T1. So that's just the cervical portion of it. C3 to T1 is under here, and it inserts on the adjacent process. So, for example, it'll originate on C3 and insert on C4, originate C4, insert on C5, etc. And that is the cervical portion of it. The multifidus goes the whole way along to the sacrum, but it has different function in each section. So its function in the cervical section here is to flex the neck to the contracting side and to rotate the neck to the opposite side, and also to extend the neck when acting bilaterally. And that is the multifidus muscle here. So you can kind of see this sort of look like that. Semi-Spinalis. So Semi-Spinalis originates on the transverse processes of T1 to T7. So T1 is underneath the scapula, well, so are most of these first 7. And on the articular processes of C3, so C3 here, to C7. So it originates along here, and it inserts up here on the occipital bone. So it goes the whole way from the neck to the start of the back. It attaches to all of these vertebrae. So its function when contracting bilaterally, so both sides together, helps to cause elevation of the head and the neck. When contracting unilaterally, so one side at a time, it bends the head and the neck to that side. And that's the Semi-Spinalis. Supraspinatus. So supra means in front. So the supraspinatus, this muscle here, originates on the scapular cartilage, so up here, and the spine of scapula. And it inserts on the greater trochanter of the humerus, so that bone there. So it goes like that. And its function is to extend the shoulder and assist in abduction, so that's to take away, and lateral rotation of the foreleg. It's also one of the stay apparatus muscles, so it helps to stabilize this shoulder. And that's the supraspinatus. Infraspinatus, the counterpart of supraspinatus. So infraspinatus originates on the scapular cartilage as well, but the other side, inferior, is behind, and on the spine of scapula, so they meet here in the middle. And it inserts on the greater trochanter of the humerus as well. So it goes like that. So supraspinatus was this side, infraspinatus this side. And the function is to extend the shoulder and assist in abduction and lateral rotation of the foreleg and stabilize the shoulder. So it has the same role as its counterpart, the supraspinatus. And that is the infraspinatus. So next we have our deep cranial pectoral muscle. Some call it the subclavius muscle. Horses don't have a clavicle, which is a collarbone. So we call it the deep cranial pectoral muscle. And it is one of these deep shoulder muscles. So it originates on the caudal aspect of the sternum, so the back of the sternum, and it inserts on the humeral bones, this is a humerus here, and the brachial fascia, so all the way up here. So it goes all the way around this kind of like a sling, and its function is to cause retraction of the foreleg, so to bring the foreleg backwards, to help suspend the trunk between the forelegs, and to stabilize the shoulder joint. And that is the deep cranial pectoral muscle. The descending pectoral muscle. So descending pectoral, so we did the ascending pectoral along here, descending, descends down. So it originates on the upper third of the sternum. So this is our sternum. Originates on the upper third of it and inserts on the deltoid tuberosity and the crest of the humerus down here. So that's this one here. And its function is to cause the adduction, so bringing inwards of the forelimb, and assist in protraction, retraction, and stabilization of the forelimb. So it's also one of these stay apparatus muscles. And that's the descending pectoral. The spinalis. So the spinalis muscle goes along the spine, so it's very deep. So it originates on the spinous processes L6, so here, to T13. So L6, 5, 4, 3, 2, 1, T18, 17, 16, 15, 14, 13 here. So it originates here and it inserts on the spinous processes of C3 here to T7. So C3, 4, 5, 6, so anyway, under here. So it goes the whole way along here, under the scapula. So it covers the neck, back, and lumbar region of the horse. So its function when contracting bilaterally, both sides, to extend and stabilize the lower neck. This is our lower neck here. And when contracting unilaterally, so just one side at a time, it contributes to rotation and lateral bending of the neck to the same side. So it is main functions and neck functions, but as it has attachments the whole way along the back, it also contributes to the stability and function of the back here. And that is the spinalis muscle. The deltoid. So the deltoid muscle originates on the caudal border, so the back border of the spine of scapula. So our spine, so that's the back border there, and it inserts on the deltoid tuberosity here. So it's goes like that, and its function is to abduct the arm, so take the arm away and flex the shoulder joint. This is our shoulder joint here, and that is the deltoid. This is the Teres Minor. So the Teres Minor originates at the caudal border of the scapula, so the back of the scapula, and it inserts on the caudal part of the humerus, so the back of the humerus. It's this little one here, and its function is to abduct the arm, so take the arm away, flex the shoulder joint, so flex it that way, and assist in lateral rotation of the shoulder. And that's the Teres Minor. The Brachialis Muscle. So the Brachialis Muscle originates on the humerus and it inserts on the radius. So it goes over this bone here, and its function is to flex the elbow joint, this is this joint here, and rotate the radius laterally, and that is the Brachialis Muscle. The Tensor Fascia Antibrachial Muscle, or Tensor Fascia Antibrachial Muscle, depending on your pronunciation. So this muscle originates at the caudal border of the scapula, the back of the scapula, and the latissimus dorsi fascia. And it inserts on the ulna, so this bone here, medial aspect of the olecranon, so that's the end, the middle aspect, and the antibrachial fascia. Goes down like that. And its function is to extend the elbow joint, so that's this joint here, and tense the antibrachial fascia. And that is the tensor fascia antibrachial. Deep digital flexor. Now this becomes a tendon as it goes past the knee. And that's your deep digital flexor tendon, which you've probably all heard about. So the deep digital flexor originates at the humerus and it inserts on the radius, and it goes down like that. So it originates on this side, goes over here, down here. And its function is to flex the elbow joint, this is the elbow joint, and rotate the radius, this is the radial bone, laterally. And that is the deep digital flexor muscle. Flexor carpi ulnaris. So carpi is your knee, ulnaris the ulna here. So it originates on the medial epicondyle of the humerus. So medial is the underneath to the center of the body, so we can't see it from this two-dimensional drawing. The ulna, it's this bone here, and the medial olecranon. So the olecranon was this tuberosity. The medial is obviously the inside of it. So it originates there and it inserts on the accessory carpal bone, this bone here. So it comes from under and down. And its function is to flex the carpal joint, which is the knee, so to flex the knee. And that is our flexor carpi ulnaris muscle. The longissimus dorsi, the long back muscle, very important back muscle. So this back muscle is part of the appearance of top line on our horse. So it originates on the spinous processes of L1, so the first lumbar, to S3, the third sacral. The top of them, the spinous processes. So it originates back here, and the transverse processes of all the thoracic vertebrae. So the whole way along here. And it inserts on the transverse processes of C4 to 7. So C7, 6, 5, 4. And the rib tubercles. So where the little ribs. So it goes whole way like that underneath the scapula. So it's a really long muscle. So its function when contracting both sides together bilaterally is to extend and stabilize the back. So it's so important for the strength of the back. When contracting unilaterally, so one side, it bends the spine to that side. And also it does help in assisting in extending the neck because it does attach up here at the neck. and that is the longissimus dorsi muscle. Medial gluteal muscle, middle gluteal. So the middle gluteal originates at the ilium. So this is your ilium bone here. The sacroiliac ligaments, which are the ligaments around the sacroiliac joint, and the longissimus dorsi, so the muscle that we just looked at. And it inserts here on the greater trochanter of femur. So it's got all these points down here. So it originates right up here in your lower back. So that's called the medial gluteal or middle gluteal tongue, because it's kind of got this tongue-like projection to the middle of the back here. So its function is extension of the hip joint. This is our hip joint here. Abduction, so to take away, and medial rotation of the hind limb. And that is the medial or middle gluteal. So our deep gluteal, which is the most medial aspect, or medial gluteal muscle, the deepest one, originates at the ilium. So this was the ilium here, and the spine of the ischium. So the ischium is that part of the pelvic bone there, and it inserts here on the greater trochanter of femur. So it just sits over this bone here. And its function is extension of the hip joint, that's our hip joint, abduction and medial rotation of the hind limb. And that is our deep gluteal or gluteal profundus, it's sometimes called. The Bracillus muscle. Now this one is actually the inner thigh. So a little difficult in a two-dimensional drawing, and originates on the pelvic symphysis or pubic symphysis, which is the middle part of the pelvis. So we can't see it in this two-dimensional drawing. And it inserts on the crural fascia, the medial patellar ligament, and the cranial border of the tibia. So it doesn't actually have very many. So it originates up here and it inserts down here, and the rest of it is actual fascia and ligament attachments. And it fills in this inside bit of this femur area here, and it adducts the hind leg, so brings the hind leg towards the body. So it kind of holds the hind leg here in towards the body, and that is our gracilis muscle. This one is the internal abdominal oblique muscle. So we did the external abdominal oblique in the superficial muscles. This is the one that sits deeper, so more medially to it. So it originates at the tubercoxy here and the inguinal ligament, which is sort of around here. And it inserts on the 18th rib and the costal cartilages, so the cartilage of the ribs, from the 14th to the 18th. So 18th, 17th, 16th, 15th, 14th. And it just kind of connects up like that. And the function is to support the abdominal viscera and for defecation and expiration. And that is our internal abdominal oblique muscle. Okay, this is a hard one for people to pronounce sometimes because it's a silent P, the psoas muscle. So the psoas muscle is a deep, deep pelvic muscle associated with the psoas ligament. So it originates on it, so it's got a major and a minor. So you've got your psoas major and psoas minor. The major part originates on the 17th to 18th ribs, but the inner aspect of them. The transverse process of the lumbar vertebrae, so these vertebrae here. And the minor originates T16, so 16, so you have 18, 17, 16 to L5, 1, 2, 3, 4, 5, and the 16th to 17th ribs. Then they insert, the major portion inserts on the lesser trochanter of femur. So that's our greater trochanter, this is our lesser trochanter here. The iliacus tendon or iliac tendon, which is one of the inner pelvic tendons. And the minor inserts on the psoas tubercle of the ilium, so just here. So it's a really interesting well, it's got two portions to it. And it's deep, deep within the pelvis. And that is the Psoas muscle. Iliacus muscle, so another deep, deep pelvic muscle. It originates in the ilium, this is this bone here. The Psoas minor tendon, so one of the tendons of the psoas. The ventral sacroiliac ligament, which is one of the big sheet-like ligaments near the sacroiliac joint. And the wing of the sacrum. So up here, this is our sacral area here. And it inserts on the medial edge of the femur, so the inner edge of the femur, and the psoas major tendon. And it sits on the medial aspect of this bone, so right inside the pelvis. And its function is to flex the hip joint, this is our hip joint here, and rotate it laterally. And that's the iliacus muscle. Femoris muscle. So the rectus femoris muscle originates on the ilium. So this is the ilium here. And it inserts on our patellar ligament down here and our tibial tuberosity here. So it goes over there. And its function is extension of the stifle and flexion of the hip joint here. And that is the rectus femoris muscle. The vastus lateralis muscle sits right next to the rectus femoris. It originates on the femur. This is our femur here. And it inserts on the patellar ligament and the tibial tuberosity, same as the rectus femoris. And it's a vastus means a vast, and lateralis means lateral. So it sits more laterally, and it's a big, bulky muscle. And its job is extension of the stifle. So these muscles, like the rectus femoris and the vastus lateralis, all contribute greatly to the function of the stifle itself, with their attachments to the patellar ligament and their functions in movement of the stifle. And that is the vastus lateralis muscle. The soleus muscle. So the soleus muscle originates at the head of the fibula. So the tibia is this big bone here, and the fibula is this tiny little bit there, and that's the head there. And it inserts on the gastrocnemius tendon, which this is our gastrocnemius here, and this tendon goes the whole way along here. So it's like that. And the soleus muscle, its function is to aid in extending the hock. So you can see its relation to the hock here, and that's the soleus. The deep digital flexor muscle. So the deep digital flexor muscle becomes the deep digital flexor tendon here as it goes past the hock. But this is the muscle portion here. So it originates on our tibia, which is this bone here, the fibula, which is the little part of it. So tibia, fibula, and the lateral condyle of the femur. This is our femur, lateral condyle, and the lateral condyle of the tibia. And it inserts on the flexor tuberosity of the hock. So it goes there. As it goes over the hock, it becomes tendon, because there is no muscles in the distal limb. So they become the tendons. So that is the deep digital flexor muscle. The Semitendinosus muscle. So the Semitendinosus muscle originates on the transverse and spinous processes of C5, so 1, 2, 3, 4, C5 to CA, which is caudal 2, 1, 2. So it originates here, and it inserts on the tibia here. So this is your gastrocnemial tendon here. So it goes down over the ischiatic tuberosity and goes down here. And its function is flexion and extension of the stifle through its interaction here, as well as extension of the hip joint. This is the hip joint here, and the hock down here, and medial rotation and adduction, so to bringing in of the hind limb. And that is the semitendinosus muscle. The gastrocnemius muscle. The gastrocnemius muscle originates on the femur here, there. And it inserts on the calcaneus. This is our calcaneal bone here, on the calcaneus and the tarsal joints, so on the inside here of the hock joints. And it's got a big body there, and it sort of becomes tendinous as it goes down here. And its function is flexion of the stifle, so it's a stifle up here, and extension of the hock down here. And that is the gastrocnemius muscle.